Gabby Trach, 7th semester nursing student. Today is September 16th, and I will be demonstrating how to trach suction as well as perform trach care. Before I've gone in my patient's room, I've assessed their current condition, their respirations, their lung sounds, rate, and rhythm. I've also assessed their overall condition and if there's an order for the suction to happen. So I've gathered my equipment on the table, so I'm going to go ahead and go in my room, perform hand hygiene. Hello, Miss Jones. I'm Gabby. I'm your student nurse today. I'm going to go ahead and suction your trach out and also do some care on it, clean it up a little bit for you. You got some secretions there. Can you give me your name and date of birth? Perfect. Thank you. I have provided privacy. I have my suction hooked up on continuous between 80 and 120. I also have oxygen for my patient here. I'm hyperoxygenating them. So I have it turned up before I get started. I'm gonna go ahead and place a towel over your chest, Miss Jones, just so we don't get a bunch of stuff everywhere. And now I'm gonna go ahead and set up my field for my suction. So this is new, sterile. If it was not, I would go ahead and lip it over a trash can before dumping it. And now I'm going to go ahead and open up my suction kit, making sure to not break sterility during this. I'm going to go ahead and put those sterile gloves on. Dominant hand first. And now my non-dominant. And now I can fix this hand since I am sterile. Okay, now that I'm completely sterile, I can get out my tubing and then hold this in my dominant hand the whole time, and my dominant hand is going to stay sterile, whereas my non-dominant hand, my left hand, is going to break sterility. So the first thing I'm going to go ahead and do is attach my tubing to the suction, and I can go ahead and check that my suction is working by running some water through it, lubricating it. It looks great. So I'm going to go ahead. We're going to remove your oxygen here, Miss Jones, and we're going to go ahead and suction out those secretions. When I suction, I'm going to go down without suction until I meet resistance. Suction on the way out. Perfect. Give my patient at least 30 seconds to a minute to recover from that. If she's feeling distressed or anything, I'd of course stop, reassess her. But I do see that she does need to be suctioned again, so I'm going to go ahead and clean my tubing. And we're going to suction again. All right, Miss Jones, if you're feeling uncomfortable, go ahead and raise your arm to tell me that on this next pass. I'm going to go down until I meet resistance. Suction on the way out. I shouldn't do that for any longer than 5 minutes. It's a lot to handle. So I'm going to go ahead and unattach my suction. And while I'm here, I can also take away the dressing because I'm going to provide for trach care next. Take off my sterile gloves, take away this field, perform hand hygiene. I'm also going to set this off to the side since it still has some water in it. I don't want to make a mess. And now I am good to set up my next field. Before doing so, I can document how my patient tolerated that and as well as assess them again before starting another procedure. So we can go ahead and open up our trach care kit. Now I can apply my gloves. Again, maintaining sterility throughout this. I'll put my dominant hand in first, non-dominant next. Once I've done so, I can also use this as my sterile field, making sure to not go without that 1-inch border. I have another sterile field if I'd like to set it up, so I'll just make it a little bit bigger and set it up. Perfect. Okay. Now I'll take out my containers, set them up on my field. Have my dressing, my Q-tips, my new tie, and some gauze, as well as my saline and my peroxide. So my hydrogen peroxide, I will dump in one container, And then the saline I will dump in the other 2 containers. Now that I'm all set up with that, again, I'm going to be breaking sterility with one of my hands. So I'm going to break sterility with my left hand and take out the inner trach. We're going to dump that into the peroxide, let that sit until I see it bubbling and really getting clean. When I'm done seeing that it's getting clean, I can take it out, grab my sponge applicator, clean around it, clean in it. Again, still holding it with my left hand. Discard of that, and now put it in the normal saline. Let that soak for a little bit. When I pick it up, it's going to be clean, so I'm going to use my sterile hand. Kind of tap it along the inside and come over here. We're going to insert that back in, okay? Okay, so now we're inserted back in. The last thing I can do, next thing I can do is clean around the area on the skin with some swabs and saline. So I'm just going to kind of clean around the trach, the skin, make sure I get all the secretions cleared up. Clean with one more, make sure I get the actual trach applicator. And then what I want to do is go ahead and dry my area and her skin to prevent breakdown. So I'm going to dry it really good because I don't want Miss Jones to have any breakdown. Once I do that, I can go ahead and apply my new trach tie. Because I'm by myself, I'm going to keep the old one on, apply this one, and then I'll take the old one off, just to ensure that it actually stays in place and doesn't get dislodged, because that would be uncomfortable for Miss Jones. So I'm going to wrap my tie around here. All right, Miss Jones, we're going to lift your head forward so we can get this other side on there. Perfect. This side on there. Now I'm going to take off the old tie. So we're going to go around again, Miss Jones, and get that old tie off. Okay. Now that we've got the old tie off, we can discard that and make sure that we only have about 1 to 2 fingers between the tie and her neck. I don't want to choke her, but I also want it to be tight enough that it's not going to fall off. So I'm just going to tighten it up just a little bit here and recheck, which I can get my 2 fingers in there, so that's good. For video purposes, I would take off my sterile gloves and reapply new sterile gloves. But for video purposes, I'm not going to do that. I'm just going to use these gloves and say that they're sterile. I'm going to now apply a new dressing. So when I apply this, I'm going to start underneath of it, go up and around, making sure that there's no creases, folds, making sure it's straight, and covering the entire trach. Once I'm done with that, I can take off my gloves, perform hand hygiene, reassess my patient as needed, clean up my area, and document everything that I did for care today.